Hello relatives, welcome to this week's Schlag for the week April 19th, 2010, entitled Pick Up the Dog Poo. I addressed the National Association of Children's Hospitals just when President Obama's healthcare bill was signed into law, and I began my presentation by saying it didn't really matter whether it was the government or private insurers who were paying the bill, because the current healthcare delivery system was dysfunctional and was going to bankrupt us. The current interventional model, a model that requires people to get sick and diagnosed before they get treated and before doctors get paid, that has to change to a model that's based on prevention. I said that we are looking at epidemic obesity among kids, and it's going to result in an enormous increase of early onset diabetes, and this increase will be dramatically pronounced among African American children who may be predisposed to the disease, and especially among the poor whose diets are loaded with cheap processed foods because supermarkets that offer healthier choices really don't want to come into the neighborhood. We will also see an epidemic rise in mental disorders because the new psychiatric diagnostic manual, the DSM-5, now defines unacceptable behaviors as diseases. There will be an astounding rise in new diseases that mirrors the rise in ADD and ADHD diagnoses over the last, certainly, 15 years. Now we will have new diseases, behaviors defined as diseases, like eating too much, binge eating disorder, or laughing or crying too much, involuntary emotional expressive disorder. Of course, for those of us who raise teenage children, you know, if you're laughing or crying too much, it's quite ordinary. But the treatment for all of these is going to be expensive drugs, and the long-term effects on children are really unknown. So I want you to think about a paradigm-shifting health prevention model, and as a model that can be immediately implemented. So to parents, if your kids are acting up, if they're unfocused, undisciplined, and unresponsive, learn how to set limits and how to enforce them. Teach your children that there are consequences to their actions. If you don't pick up the dog poo in the yard, all of it, then you're not going to go out to play. If you continue to act irresponsibly, your cell phone's gone. You get the idea. Limit setting is an ego-corrective experience. You have to create boundaries and then stick to them. And stop bullshitting your children. Not everything they do is exceptional and praiseworthy and so incredibly wonderful that it is deserving of over-the-top accolades. In the real world, the little princess or the big guy is going to really have to perform. They ought to get used to it. And let's restore the dinner meal to a family ritual. Sit down together, eat healthy food, talk to each other realistically about what's important in your life. What are your values, your dreams? And here's a shift for children's hospitals. Cafeterias have got to stop serving cheeseburgers and waffle fries. You got to be an example of nutritional health. Hospitals need to get into the community, provide healthcare education in schools, community centers, churches, barber shops, wherever people gather. And talk to children in their language. I mean, get on Facebook. Tell your story on YouTube and Twitter. Build a network that teaches them how to become the principal agents in maintaining their health. Invite students into your facilities. Let them see what you do. Use the hospital as a meeting place for education and recreation. There is so much poo around, lots of it of our own creation. Let's stop wallowing in it and pick it up before we all drown in it. Those are my thoughts for this week. You know, I wish you a wonderful week. I want to say thank you for all of those of you who have written birthday wishes. Touches my heart. And for those of you interested in a workshop that's taking place in Phoenix, May 21st to the 23rd, the only time in this country, called Healing Ceremonies, early registration rates still apply. Come to the homepage at www.healingdoc.com. Remember, we're all in it together. Let's tell each other our stories, remind each other that we have something to learn by listening to each other and sharing our truth. Have a great week. I say this for all my relations. Mitakuye.